Subscribe for more. Executive Order 14,221, Making America Healthy Again by Empowering Patients, with clear, accurate, and actionable healthcare pricing information. February 28, 2025. Section 1. Purpose. This executive order builds upon healthcare price transparency initiatives started during the President's first term, aiming to empower patients with clear and accessible healthcare pricing information. Key issues identified. Lack of price transparency. Historically, patients and employers have been unable to obtain clear and advanced pricing information from hospitals and insurance companies. This has allowed opaque pricing practices to inflate healthcare costs without accountability. Past regulatory efforts. Executive Order 13,877, June 24, 2019. Required hospitals and health plans to disclose negotiated rates for healthcare services. Mandated consumer-friendly pricing tools for patients and employers. Economic benefits of price transparency. A 2023 study estimated full implementation could save consumers, employers, and insurers up to $80 billion by 2025. A 2024 report found that price transparency could help employers reduce healthcare costs by 27% across 500 common services. Early price transparency enforcement led to a 6.3% annual drop in the highest-priced healthcare services. Failure of the previous administration to enforce price transparency. Hospitals and health plans were not held accountable for failing to comply. Prescription drug price transparency requirements were not fully implemented. Policy goal: reignite and strengthen healthcare price transparency to make healthcare more competitive, innovative, affordable, and higher quality. Ensure patients can access clear and actionable pricing information for healthcare services. Section 2. Policy. The federal government will pursue a strong price transparency policy by ensuring universal access to clear and accurate healthcare prices, strengthening enforcement of existing price transparency rules, exploring new opportunities to expand transparency requirements. The goal is to provide patients with the information they need to make informed healthcare decisions. Section 3. Fulfilling the promise of radical transparency. The Secretary of the Treasury, Secretary of Labor, and Secretary of Health and Human Services, HHS, are ordered to rapidly implement and enforce healthcare price transparency regulations, including 3. A requiring disclosure of actual prices. Hospitals and health plans must publicly disclose actual prices, not estimates. This ensures patients see real costs before making healthcare decisions. 3B. Standardized and comparable pricing information. Agencies must issue updated guidance or new regulations to ensure pricing information is uniform across hospitals, health plans. This will allow easy comparison of prices between providers. 3C. Strengthened compliance and enforcement. Agencies must issue new guidance or regulatory actions to improve enforcement policies, ensure compliance with accurate, complete, and meaningful data reporting. Deadline: within 90 days, agencies must take action to strengthen price transparency enforcement. Overall summary: this executive order reaffirms and expands the healthcare price transparency policies initiated in 2019 to empower patients, employers, and taxpayers with clear and accessible pricing information. Key objectives: ensure all hospitals and health plans disclose real prices, not estimates. Standardize pricing information across providers to improve comparability. Strengthen enforcement measures against non-compliant entities. Expand transparency rules to cover more services, if necessary. Expected benefits: lower healthcare costs for consumers and employers, greater competition and innovation in healthcare, improved decision-making for patients through clear pricing data. The administration aims to fully enforce and expand these policies to create a more transparent, competitive, and affordable healthcare system. Subscribe for more.